Hi, everyone. I'm so excited to see you all here, and I will be admitting people as they come. So we have a lot more people just showing up. So I'm really honored to have a special guest today with me, Shawna Melbourne. She is very near and dear to me, and she's been someone who I've been having so many conversations with, and I really admire all the things that she's doing and the things that she's done. So I'd love to be able to bring her into this space so that I guess I can share her with all of you as well. I think everybody could use a little bit more of Shauna's knowledge and expertise and compassion. So, for those of you who don't know me, I'm Joyce Faraj-Ardura. I am a dietitian. I'm also the CEO and founder of the Nutrition Counseling Academy, and I have my own private practice, Joyceful Nutrition. I, the whole idea behind the Nutrition Counseling Academy and the Facebook group is to be able to connect with more dietitians and be able to provide any type of support that might be needed, whether it's having conversations like these, extending their exposure to different types of conversations when it comes to nutrition counseling. And this is a particular topic that many dietitians are struggling with, and that's what do I do when I'm seeing a client who might have disorder eating or eating disorders? So then why not bring someone who has been working in this field and has the expertise and knowledge that is going to be much appreciated by many of us. So I want to let you introduce yourself, Shauna, and then when I kick it off, we can have this be very informal, very conversational. So if you have any questions, you can go ahead and drop them in the chat, or you can also, raise your hand and we can have you unmute. But we do have some things prepared as well that we can talk about. So go ahead, Shauna.
Oh, and thank you so much, Joyce, for having me here and just like a really heartfelt introduction. You said some really kind things. Thank you. I'm really honored to be here and to talk about the topic that is very near and dear to my heart, which is eating disorders. And in particular, when we feel really stuck. And there's so many examples when us dietitians can feel very stuck in our counseling sessions. And, when we didn't learn about eating disorders in school, and it doesn't necessarily come naturally to all of us. And so, which is why, I've really dedicated my entire career for the past 20 years being a dietitian to eating disorders. And 8 years ago, actually, in May, I developed ED for RDs, eating disorder education for registered dietitians. I just said that the other day thinking, wow, it's been 8 years.
It's
I
amazing.
spent it. I know, yeah, like 8 years, well before online programs became kind of the way of learning. And yeah, I started it when I was on mat leave with my son when he was like 4 months old. I thought, I'm gonna do this. And I just had no idea that it would have such an impact that it has. When I started it, I thought, oh, it'll just be like kind of like a side thing that I'll do to help other dietitians learn about eating disorders because, again, this is such a gap in our knowledge, and yet we're like the first line of treatment in so many situations, and we're just left with like, what do I do? What do I say? I'm scared of this. I'm scared of saying the wrong thing. How do I even support? Like, just so many questions. And so
Many.
I developed that ED for Arties, and we have all kinds of different ways in which dietitians can learn. In particular, we have our newest course, well, kind of our rebranded course, I guess, which is ED for Arties Essentials. And it's a program just for like early to maybe intermediate learners when it comes to eating disorders. And then we have various other pathways of learning. And so, yeah, here we are, being able, having the opportunity to talk about eating disorders again, which is always my favorite topic.
Thank you for sharing that because I remember as an undergrad, I never really took a class in eating disorders. It was not something that we talked much about. And then fast forward to when I was teaching at the university level, I was teaching the eating disorders module within a medical nutrition therapy class, and that's the only class that dietitians got in their training. And
Right.
that was just 1 week. So it was 1 week of eating disorders. And really we could just pick one. So we could just go into one particular eating disorder and talk
Right.
about the management, the treatment, and a case study. But that was it. That's the exposure that we got. And I remember back in 2017 when I was looking for training for eating disorders, there was one available out there. And I was very fortunate that I took it. And but th there wasn't that many. And I think there still isn't because it does require a certain level of expertise to be able to, get to the point where we're able to create something that's going to be very valuable for the rest of us. So we really appreciate you, putting this out into the world during your maternity leave 8 years ago. And
Yeah.
I'm sure you've had hundreds of dietitians, if not more, go through that program in the past 8 years.
We have. It's really, when I started ED for IDs, it started off as actually a 3-month course. And I quickly realized that, oh my gosh, I just can't teach all of this information in just 3 months. And then it grew to a 6-month course, and then it grew to a year-long course. And now we have ED for RD's essentials, but then we have all these various other pathways for learning. And if I look back on my university teaching 20 years ago, 25 years ago, I learned like the diagnostic criteria.
Yeah.
And to me, it feels like if we were to learn like the definition of diabetes or the definition of like, I don't know, high cholesterol or something, and then just expected to just go out there and treat it and to support people. And that does, as we can all imagine, it does us such a disservice as a profession, but also the people that we are trying to support. When we only have like the DSM-5 diagnostic criteria, yes, that's a start, but it doesn't even begin to grasp how to support, how to be there, how to show up, how to open our hearts, and to also chip away at our own fears and our own worries and to show up in a confident, competent way. And that takes time. So, for me, developing programs and ways to support dietitians, it isn't just about the content that I create. For me, it's more about how do I support dietitians? How do I show up to best support a dietitian who's feeling incompetent, really scared, very worried, doesn't have the answers, perhaps up against other team members that may not see the gravity of the client's
Mm.
situation, how to work together with a team, how to feel like we have a say in how to show up and treat clients as well, and how to feel like we just have more tools in the toolbox to be able to navigate these some really tricky situations that pretty much guaranteed to arise when we work in the space of mental health.
Absolutely. And I think you hit the nail on the head. There's a multifactorial approach to treating eating disorders. So then it's not just having the knowledge or having the practical skills, but it's also about how you show up, and how
Yes.
you are able to express that empathy and that compassion. And it's like the whole package, right? So then we're
Yes.
working on different things that we're trying to master or gain proficiency in, and that takes time and that takes supervision. So one of the things that many dietitians are scared of is, am I doing harm here?
Oh,
How do
yes.
I support this client in a way that I'm not doing harm? And I'm going to open this up to questions, concerns that you might have. I think this might be one of the biggest ones, that fear of, am I actually doing what I need to be doing? At what
Mm.
point do I know if, the theory that I've learned, I'm applying it well or not? So
Mhm.
then I think that might be one of the questions that many might have when it comes to supporting clients who have eating disorders or disordered
Yeah.
eating.
Yes. Oh my gosh, is that ever such a prevalent thing that I think not only do dietitians feel, but other healthcare providers also feel as well. So it isn't just like a dietitian thing. It's like, healthcare wide. And it's, if I think of myself going into, I don't know, I'll just pull something out like infant feeding as an example. I'm going to feel really scared because I just don't know about infant feeding. I don't know how to properly assess an infant for specific feeding requirements. I don't know how to do that. So if I were to go into infant feeding, which I'm not, but let's just pretend here, I hope that I would be able to seek out somebody who can train me, teach me, be there for me, have opportunities for me to just have some supervision, have some sessions with a more skilled dietitian so that I can work through cases and situations and, have my laundry list of questions to get answered. So I think it's also, I think part of it is it reflects on just normal. It's really normal that we would feel scared in an area that we just don't know a lot about.
Hmm.
And so it's really, really normal to feel scared and unsure. And am I causing harm? I would feel that same way if I were to go into infant feeding. So again, really, really normal. I think it also reflects just our underlying compassion and care that we have for other human beings, especially those that we can appreciate that are in a very vulnerable situation. And so that fear and that worry that you have, I think of it as, again, that reflection of how compassionate and just how much you care. So, what do we do with that fear and what do we do with that worry so that we can work with your compassion and your care that's already there and try and turn it into feeling confident and confidence, right? So, the skills that you already have, how do we take them and how do we apply it to eating disorders? And what I usually say about, the learning curve of eating disorders is that it often feels extraordinarily steep and long at the beginning.
Hmm.
And this is where I get dietitians feeling like, oh my goodness, there's just so much to learn. There's so much with under the umbrella of eating disorders. And where do I go? What do I do with all this information? So the learning curve can feel quite steep and long at the beginning. But it usually starts to kind of taper off, or at least, I mean, it's never like, it's an always like it's never ending learning process, but it starts to feel a little bit more doable after maybe 1 or 2 years. Now, I know that that can seem very long and really steep and a lot of commitment, but at the same time, we can't forget that you're going to be learning a lot from not only a supervisor or somebody who's more experienced than you, but also we learn so much from our clients. That it's their responsibility to teach us, but we learn so much from the individuals that we are working with. Um, and yeah, so that's kind of what I think about when the actual learning curve. And also that we do reach a place where we do start to notice the patterns of how the eating disorder shows up.
Hmm.
We have our diagnostic criteria, which means that to me it highlights just how the eating disorder shows up very similarly from person to person, because we can extract these commonalities between, this person living with anorexia and this other person living with anorexia. And so the eating disorder shows up very similarly to person from person to person. However, it's the individual experiences that are vastly different. And that's what tends to make our learning curve quite long and steep at the beginning. But there's hope. There's hope that we can turn your compassion and your desire to learn into real tangible skills that you can use in your everyday practice. The other thing too is that I encourage dietitians that you don't have to know everything about eating disorders, before you start working with individuals living with eating disorders. Again, I think that there is a foundation of skills, very specialized skills that I think all of us need to have, not just those dietitians who are thinking about specializing in eating disorders. I think we all need these specialized skills. So if we have the foundation of these specialized skills, then we can go into these sessions with a lot less worry and a lot less anxiety about saying the wrong thing or causing harm. Now, I will say too is that while we're learning these foundation of skills, it's so important that we have a more experienced dietitian working alongside us, because as we work with one person living with anorexia and another person living with anorexia, we need to appreciate the nuances of how the eating disorder shows up and also their personal experience with it. And so to have a supervisor there with you, that's how we can um, cause less harm and show up with a lot more confidence.
Yeah, I think that's great advice. And I'm also thinking that even if you might not be seeing clients yet, um, being in a group setting, getting group
Yeah,
supervision with other dietitians who are bringing in cases, you can learn about what's going on there and what is being discussed in these groups as well.
absolutely. Yes. Oh, yes. That's such a great point is learning from other dietitians and knowing that you're not alone. So much of what we experience, we think, oh my gosh, am I the only one that is feeling so scared or unsure about this particular topic or situation, and yet learning alongside other dietitians, we start to unlock that so that we're not feeling alone. And that's why I have a supervision program. So our supervision program is actually, we meet once a month, and it's myself and two other dietitians. So it's small group learning, and we meet for an hour every month. And it's a really wonderful, I really love this. I know it's not about me, but I personally love the supervision program because I really get to know the two dietitians that I'm working with, and they get to know each other, and it becomes a really intimate way of learning. And it isn't just sharing knowledge or like getting questions answered, it's also about growth within the individual dietitian as
Mhm.
well. And, some of the dietitians that have been in my supervision program have been there for a couple of years, and just to see how much that they have grown as individuals in a on a professional level is just so exciting to me to be alongside them as they continue to grow and feel more competent and confident in this area.
Absolutely. That must be amazing for you as, the supervisor, I guess, to see the growth that your dietitians are having in that group, but also seeing them gain the skills and the confidence and being able to help each other out.
And to help each other out. And friendships are formed as well. That sense of community, that they aren't alone, and they end up talking outside of our supervision sessions, and they have the chance to coordinate with each other as well.
Yeah, and I'm gonna add that in the world of like therapists, because I work with many therapists and social workers, psychologists, supervision is a very common aspect of their practice,
Yes.
supervision. And I think that within dietetics, I see it more often in eating disorders, which I think is amazing. But I love this idea of spreading to other areas of dietetics as well, because it really is one of those like accelerated learning opportunities where you're really diving deeper and being able to get a lot more out of the conversation with the other dietitian and with the supervisor.
Yes, yes. It's like common practice in the therapy world. And yeah, even when I was beginning in eating disorders, it wasn't like what it is today amongst dietitians and eating disorders. We had perhaps some case consultations here and there, but
Hmm.
it wasn't as well known or accepted in our dietetics profession to engage in supervision. And thankfully, it has grown quite a bit in our dietetic profession to accept supervision and engage in it.
Yeah, that's amazing. So I'm going to shift gears and I'm going to ask a question But I would also like to open it up. If anyone has questions, you can start thinking of your questions. You can type them into the chat. So, a question I have, Shauna, and we can discuss this, is let's say you have someone that wants to meet with you, and there are no like obvious signs of an
Mhm.
eating disorder. And they're saying, well, I just want nutrition education. I want to lose weight. And then the more conversation you have with this person, you're starting to see some rigidity there. You're starting to see some red flags. So then I'm curious, what advice do you have for dietitians who might be experiencing this to figure out what might be those things that might help you screen for disorder eating or eating disorder that
Right.
might be helpful regardless of what the client might think they're looking for?
Amazing. Oh, I love this question. Yes. Okay, let's untangle this. You think I can do this in like 20 minutes? So, right off the bat, the red flag that I would invite us all to take a look at is the client wants to lose weight. That's the very first red flag. Whether or not that there's rigidity there or any other signs of, say, restriction or binging or any other kinds of disordered eating or eating disorder symptoms. It's the fact that this person wants to lose weight. To me, it shows a couple of things, or the possibility of a couple of things. It shows that this person is not very happy in their skin. They are most likely feeling, or they could have experienced perhaps some body image trauma in the past, maybe some nutritional trauma, either current or in the past. I'd be really curious about their experiences with perhaps healthcare providers or friends or family commenting on their body weight, shape, and size. And so, what is the impetus for this person wanting to lose weight? Now, it might be masked in, I want to get healthy, or I want to fit into my bathing suit. Whatever it may be, what else is underlying that? Because underneath that mask, it could be, I don't feel confident in my skin and I don't feel comfortable in my skin. And the only ticket out of this is to change my body weight, shape, and size. So that is my very first red flag that I would have in my mind. And I would start asking questions like, if there was one thing that you would want to change about your appearance, what would it be? And what would that be like for you to change your outer appearance? And what is your current body weight, shape, and size stopping you from doing right now? So I want to get an idea, okay, just where is this coming from? I
Mhm.
would also ask questions like, what experiences have you had living in your skin that has left you feeling not good enough? Or what kinds of comments has anybody uh, sent your way with regards to the way that you eat or the way that your body weight, shape, and size exists in this world? So that's kind of, a much bigger topic that I could spend probably 2 hours talking
Right.
about, in terms of how would we address that and how do we go about that? What are our own internal biases as well, working with somebody with this desire to lose weight? What comes up for us as clinicians when we think, oh, okay, this person wants to lose weight. What do I do with that? Do I support that weight loss? Do I not? Do I even talk about weight? Do I not?
Mhm.
And I think what's also really important to acknowledge is not only our privileges, the privileges that we hold as an individual, but also the divide within our practice. Now I'm going off on a tangent here, but our divide within our, sorry, not just our practice, but in our profession, because we have our non-diet dietitians, and then we have maybe our more weight-focused dietitians. And there's a real divide in our practice. And so we can hear, oh my gosh, do I do it this way? Do I do it that way? And so it's figuring out the nuances of how you want to show up as a dietitian so that we can address any weight concerns or the desire to lose weight that comes up with our clients. Okay, so there's that piece. Then we have the other piece that most likely comes up for so many of us, which is, you know, how do do I help this person to lose weight? What do I do with this? Do we, figure out a meal plan for this person? Do we not? So then it would be this piece, which is a pretty big topic because you, as an individual dietitian, you get to decide how you want to show up for your clients. And also, how do we work with your individual client? The other thing that can come up is, do I even talk about weight loss, or do I, push up against it and never talk about weight? Answering these questions and diving deep into this area. So that's a thing. And then to shift gears a little bit and go into, some of these other red flags that could come up. Okay, so we have the weight loss thing. So if that comes up, boy, that's a whole topic that we could talk about. But then as we dig deeper into our what our client wants or things that pop up, like now we can see that this person could be restricting during the day. And the person is avoiding food because of fear of being too full, or, this thought of, well, I know that I'm just going to end up binging in the evening. And so I'm not going to eat anything all day, or I'm not going to eat anything all day because I don't want to eat in front of people. Or I'm so full from the night before that I'm not going to eat anything all day. So these would also be red flags. So some of the questions that I ask my clients would be, if you were to change one thing about the way that you eat, what
Mhm.
would it be? Are they totally happy with the way that they're eating? Or do they see it as maybe there's something up with this? Maybe there is some disordered eating, or it's just not normal. Or do they need me to support them to better appreciate what quote unquote normal is and what maybe is disordered eating? Now, I say quote unquote normal because that can be pretty loaded, because it depends on what we think is normal as
Mhm.
individuals, as clinicians, as humans walking our diet culture invested world. And how do we navigate that? Also, what do we do with all of this beautiful knowledge that we have as dietitians, right? What do we do with all of this? And is it our job to teach our clients what normal versus abnormal is, and, tell them all the science and the harms about dieting and the harms about, restricting during the day? How do we deliver that information without scaring them off, without leaving them feeling like they are dismissed or unheard? And how do we help them to feel supported without feeling like they're coerced over to our dietitian side of things, right? So that's a whole thing in and of itself as well. So the three questions that I generally rely on when I am seeing anybody, whether they present with the desire to lose weight or they present with an eating disorder or not. The three questions that I rely on, and I'm not the one who designed these questions, but they are questions that I rely on, is, if you were to change one thing about your body or food, what would that be? The second question that I rely on is, um, I lost my train of thought. But the second question is, if you were, oh, I got it back in my mind. If you were to eat alone versus with other people, what would I notice?
Mhm.
So I'm not asking any leading questions, assuming that this person has a problem with their body image or a problem with the way that they're eating. I'm just asking very open-ended, very non-leading questions, which is really important. And then the third question is how much time do you spend thinking about food or body? that is a very powerful question because if I have somebody that says, "Oh, I would rather just take a pill and never have to think about food again," that tells me a lot about their experience with food. That probably, that leads me to perhaps believe that this person is living with a lot of fear around food and that thinking about food leaves them with probably some emotional kickback, maybe some pain, maybe some worry, some fear, etc. So I know that there are lots of validated questionnaires out there. There's the SCOFF, or there's the E26, and there's all of these very validated and evidence-based questionnaires. When it comes to eating disorders, some of these are very outdated, although validated, but they're quite outdated and they can have very leading questions, and they can also be pretty weight biased. And so that's why I tend to move away from them, even though that they're validated, and use these three questions that are not validated, but very, very helpful when it comes to remaining curious and asking non-leading questions and ones that are going to reveal quite a bit about our clients' experiences. So I talked a lot about all of this, and I tried to stop myself from going on 100 different tangents, but I hope that that provides you with, some things to think about when we are meeting with somebody, anybody whom we may or may not detect is living with some disordered eating or an eating disorder.
Those are great questions. Thank you for sharing those with us. I think we can all start to implement parts of those questions or those questions because they reveal potentially so much more into what's going on inside someone's mind and their relationship with food than, say, the Eat 26, which I'm not a fan of, but it's what
Yeah.
was validated. So it's what you probably or I have used in the past quite a bit, but I'm not a fan of the questions. Um,
Yes.
so,
Yes.
so
Yes.
much more revealing about your client. And
Yes, very much.
along those lines, Shauna, Krista commented or posted a question. At what
Mhm.
point should a client be passed along to an RD more specialized in EDs? And I think this might be related to that because as we're asking these questions, we might be realizing, oh, okay, there's a lot more going on than what I'm potentially currently equipped to do. So then what would be the, I guess, course of action recommended at that point?
Great. Yes. Okay. A lot of things come to my mind when it comes to, do I pass this person on to a more specialized dietitian or do I continue working with this person? So I think it's a very personal question as well, because what I feel confident in could be vastly different from what other dietitians feel comfortable working with. And so I think what is so critical is that we honor our own boundaries and what we feel confident and comfortable with first. That's the very first thing. And nobody gets to tell you whether or not you should or should not refer out. That's really what you feel in your heart and what is within your own personal scope of practice. So that's the first thing that I would say. The second thing is maybe you might be waffling. Maybe you think, oh, well, maybe I could, but I wish I had a little bit more information about this. Okay, so the second question is do you have the availability and the capacity to engage in supervision while you work with this person in question? So, do you have a more experienced dietitian that you can reach out to and ask questions and receive guidance, and that you can email or pick up the phone and just say, I have this question, please help me. So, do you have that available to you? Not everybody does. Not everybody has the financial support or backup to support this kind of learning. Not everybody has the capacity to do it. So that would be another thing too that I would ask as well. And the third question is, do you want to? Because you don't have to treat somebody living with an eating disorder. If it's not something that calls to you or you're like, I just don't want to, you don't have to. So much like I don't feel confident and I don't really want to go into infant feeding. It's not something that I'm really interested in.
Hmm.
So we can all have our likes and dislikes in terms of what we want to continue working with. So those are the three areas that I encourage us all to kind of dive into before we decide whether or not we should or shouldn't or could or couldn't refer somebody on to a more experienced eating disorder dietitian.
That's a great response. Oh, I'm sorry. Were you going to add anything?
Oh no, that's okay. I just saw that Vicky also has a question here.
Yeah, so let's read that one out loud for those of you who are not able to check out the chat. So Vicky typed up, what is your favorite supporting readings for the RDs who work in RD field? Maybe ED field? Any thoughts on Carolyn Costin's book? Are you,
So
I'm not so
my
familiar.
Yeah, so some of my most favorite readings, okay, is I'm gonna see if I can easily pull it up here. So this is one of my most favorite books. It's called Edie Says, You Said, and it's an eating disorder translator, and I adore this book. I adore it. It goes through little, I don't know if you can really see it here, but it goes through little role plays of like parent and individual, and it gives you an idea of, okay, when somebody says this, what they actually mean could be that.
Oh, I love
See,
that.
oh, it's so great. So it's really, and what I really, really like about it is that the eating disorder can interpret things very differently than what we perhaps um, would prefer or intend
Hmm.
for the other person to interpret. And so getting used to the twisted nature of the eating disorder and how it shows up for that individual is so vital to this work. And when we have a deeper appreciation for how the eating disorder affects the individual, how it can show up in our sessions, how it interprets messages, this is how we get to decrease the amount of harm that we could potentially engage in. So, I love this book for that. The other book that I really appreciate is Sick Enough by Dr. Jennifer Gaudiani. This is a wonderful book for several reasons. If you're not familiar with Dr. Jennifer Gaudiani, she's a physician in the US that actually has built an eating disorder recovery program. And she wrote this book not only for clinicians, but also for parents and individuals to advocate for their needs. And I love that because individuals learning how to advocate for their own needs is a big part of eating disorder recovery. So having this book on hand is really, really important. And so it's written with safety in mind as well. So the words that she uses and the way that she describes things, she actually sent this book to a number of her clients to actually vet the information that she put in this book to ensure that it comes across in a very safe manner. So, and it's also really, really great for us clinicians to get a copy of it because it talks about the medical nutrition therapy. It talks about higher levels of care, how to best support our clients in, say, a medically compromised situation. So I really appreciate this book. Other book that I really like is, of course, I can't find it right now. It's always the case, isn't it? It's Jessica Setnick's book. It's a Well, just give me 2 seconds. I think it's down here. Yes,
The guide?
the guide.
Yeah.
This one, the pocketbook. She
Yeah.
does have a revised version, but I really like this book because it's like it just has everything you need in it. I really love this. So, what else could I give you? I have a whole bookshelf here full of books that I could go on and on, but these are my most three favorite books.
Awesome. Thank you so much, Shawna. I typed it into the chat as well. For those of you who
Right.
maybe missed it, Shauna's top three books in the field of eating disorders. And I just added the first two to my list because I do not have them. I do have the third one.
Another really good website that I'll also add, actually two websites. One is called feast.org. It's actually a website designed just for parents and caregivers, but there's some very, just like really, really great information for clinicians on that website as well. The other site that I recommend is a YouTube channel by BC, as in British Columbia here in Canada, Kelty, Kelty, Mental Health. They have a number of videos, quite a bit, and some are translated into various languages. And what I really appreciate about this YouTube channel is that it talks about what eating disorders are and how caregivers can support their loved ones. Also, there are 6 chapters or 6 videos specifically on meal support. And it gives you an inside look as to what it's like for individuals living with eating disorders to begin to rehabilitate and what caregivers are up for and what we're asking caregivers to do and what happens when we ask our clients to eat more or eat differently in the face of an eating disorder, what goes on in their mind and what happens in their mind, body, and soul. And I think it's really critical that us clinicians have that information and can watch these videos and learn from these examples.
Thank you so much for those resources. They're all in the chat as well. So, in the last few minutes, I guess I'd like to bring it back to the topic for today, and then we can share some other resources as well. Is, when you feel stuck as a dietitian and you need help, things are sticky, conversations are getting sticky. You might be thinking, but I'm not looking to become an eating disorder dietitian. But then how can I navigate these conversations as someone who can support individuals who have disordered eating?
Yes, okay. Yes, Carolyn, sorry, it's feast-ed.org. Thank
Thank
you.
you,
Thank
Carolyn.
you for that. Oh, yes. Okay, such a great question. So, there's a number of things that we could talk about when it comes to feeling really stuck and you're just not sure where to go. So, what I encourage us dietitians to do is actually to park the education is to park the education. This is super hard. It is so hard. It's hard for me. It's hard. It's like it's an everybody thing because
Oh,
feeling
we lost you for a second.
uncomfortable in class. Oh, okay. Okay. Um, so the one thing that I encourage us to do is to park the education piece. Going into education and educating our client on all the reasons why they need to change and all the reasons why their eating disorder is harming them. It's not a lack of education that keeps our clients stuck. What it is about is feeling unheard, unsafe, not seen, and alone. And so, what we need to do in our minds is shift from delivering education to more validation. And that's how we help our clients to feel less stuck, and it helps us to feel less stuck. So sometimes I hear from dietitians, well, all I did was validate in my session. We didn't make any goals. The person is still really stuck. There's no movement forward, and all I did was validate. And my message to that, my answer to that is you did everything right. And that can be the most powerful and the most therapeutic thing that we can do. Delivering education may not be exactly where it's at for all of our clients. So when you feel stuck, I'm going to encourage us to shift from education and making goals to sitting and validating. And validating can even be that reflection piece, just saying back to what that person is saying to us. Now, there's all kinds of nuances to that because I totally can appreciate that, we get into situations and our clients aren't saying anything, or they're not comfortable talking to us, and that's a whole other can of worms. And that's something that we go really deep into in supervision, as well as our essentials program. So, relying on the education piece is the most comfortable place for any clinician to be. So when we feel stuck, we end up just going to the education piece. I do it, we all do it. I just found myself doing it just the other day. So it's a very natural thing for us to just flip into is the education piece. And so it's very hard for us to flip out of it and stay within the validation piece. So I just want to honor that and acknowledge it's hard. It's really hard. So that's one thing, diving really deep into our counseling skills that you're doing with Joyce and really getting used to that validation piece and what that feels like for you and your clients. The next piece is to take a look at what's going on with us. And this is a really, really hard piece because one of the questions that I'm going to invite you to ask yourself is really hard. It's really hard. Okay, so the question is how much pressure or expectation are we putting on our client to make a change so that we can feel better about what we're doing? Okay, really, really hard question. We all come to be a dietitian or in healthcare. Well, maybe not all, but a lot of us. We come to being in a caring role because we deeply care about our clients. And we have this space in our heart that wants to see our clients get better. Also, this space in our heart gets satisfied when we actually see our clients get better. It leaves us feeling like I'm a really good dietitian. This is going really well, and it feels really good to see our clients get better. In the eating disorder space, and in many other spaces in dietetics, it's very hard to see our clients get better. In eating disorders, we have very low recovery rates, unfortunately. And so we don't see our clients get better as much as we may in other areas. Plus, getting better can look so different. It isn't just the traditional way of recovery, like person is eating and they don't have any body image hangups or food hangups. And that just might be completely different from person to person. So, what getting better could look like, it could look vastly different from the traditional sense of getting better. And so when we don't see our clients get better, it doesn't feel good, right? We're left feeling like, ugh, am I really doing a great job? Yeah, I feel that from time to time. Am I really helping? This is really going the way that it's supposed to. And so we want our clients to get better because not only does it feel good for us, but it feels really good for our clients, right? And so that can also get us into the cycle of, oh gosh, I really got to set goals. I really have to provide education. I really have to get this person to start feeling better soon. And so taking a step back and figuring out, what does recovery or getting better look like for this individual? And also, what are my own expectations for recovery or for this person to heal? And are we on separate pages? So, if you're not sure what your client's vision is for them getting better, learning how to ask those questions and engaging in these kinds of conversations helps us to get unstuck. I will say again that supervision is one of the best antidotes for getting unstuck. Feeling less stuck is something that is really supported in supervision because you get a fresh perspective. You have a space where you can work on what's going on for you as a clinician, but also a sounding board where you can deliver the case and the two of us can, or you and your supervisor can go through the case with a fine tooth comb so that you can really appreciate from a different perspective what could be going on for both you and your client.
Thank
So
you so much, Shawna, for that.
you're
Um,
welcome.
so someone asked, can you please put into the chat the three questions? And I want to say I did not type them up, but thank you to AI Companion that I was able to find it. So is it okay, Shauna, if I type up the 3 questions for the chat?
Absolutely. Yes.
Um, so let me see. The first one was if you were to change one thing about your body or food, what would that be?
Yes.
If you were to eat alone versus with other people, what would I notice? And how much time do you spend thinking about food or body? Does that sound right?
Exactly, exactly. And these aren't questions that I personally have thought up. These are not my own. They are not validated. And they are the most non-leading questions, non-assumptive questions, and yet are so powerful. And we can often um, get so much from our clients by asking these 3 questions.
They're really not opening a little window. They're opening the doors
They
into our
really
clients'
are.
minds. So thank you so
Yes,
much for sharing those.
you're welcome.
So thanks to everyone who joined. I wanted to share a few resources now. Shauna has some amazing resources, starting with her podcast, which is really great. I'm going to share that in there too. And I wanted you to maybe share with us what the upcoming ED for RDs program is all about.
Yeah, yeah, for sure. So um, I guess officially registration has, I guess unofficially closed yesterday. But I usually keep registration open for another couple of weeks because there's always people that want to register last minute or late, which is totally fine. So right now we have registration, I guess unofficially open for ED for Artie's Essentials. And this is a program designed just for dietitians that may be new to eating disorders, or maybe you have some experience with eating disorders, but you're feeling stuck. You're feeling really unsure. You're not sure what to do. You're worried about causing harm. You want to be able to support individuals living with eating disorders, but you may or may not feel like you want to specialize in this area. And it's the foundational skills. It's the essential foundational skills that I might be biased, but I do feel that all dietitians really need because again, we are the first line of treatment. We are the ones that are seeing people that, hey, could you see my 13-year-old son who wants to become a vegetarian? Or can you please see me because I want to lose weight? Or could you please see my daughter who is exercising 4 hours a day and not eating? So these are the things that we're up against, and it's really critical that we have these essential foundational skills. So that's really what this program is all about. There is some self-directed learning. There's 6 modules that are pre-recorded, and one module is dedicated to just mock sessions. So myself and another dietitian, we have acted out some very commonly experienced situations. You get to, it's like putting everything together kind of thing. And it's really, I think this is one of the most favorite modules within the course. We go through everything from what is an eating disorder, like according to the DSM-5, and then layering that with what is an eating disorder according to our clients' experiences. And we go deep into what an eating disorder really is about. We go through client examples and real life examples. I provide you with a lot of real life examples, examples that have come across my nutrition sessions as well as other dietitians. So I share a lot of that. We go through counseling skills, we go through medical nutrition therapy, we go through supporting caregivers as well. So it's pretty jam-packed full of information in the 6 modules. On top of that, you also have 12 live Q&A sessions, so monthly Q&A sessions throughout the year. And these Q&A sessions, they are live, but they're also recorded, and you also can pre-submit your questions, so you never have to miss a thing. Plus, we have quarterly guest speakers that are going to come on and talk about just various aspects of eating disorder support and care. And the next cool thing about it is that we've designed in an AI learning companion. It's called Essential Bites. And it answers your questions based off of everything that is in the course and then some. So it's not just randomly searching the internet for answers. It's like having me answer your question. And it's a little bit creepy because it actually sounds like me when it answers the questions. So it's like having me, but like a robot me. So that's what's included. Oh, we also have we just brought it out this year, and it's a community, and it's again, just that small group learning. It's a community based, it's right there within your course, and you get to communicate and interact with other dietitians who are learning alongside you. And you get to answer questions, and it's a really nice feature of the program as well.
Thank you for
Um,
sharing that. And I trialed Shauna's AI bot, and it was so good. It's like I was talking to Shauna.
You can get a free version of it it's a trial, so it's not the full AI learning companion that's available on my website, but you get a taste of it. But when you're in the program, you get the full version, it's much more robust than the free version. The other thing that we have is our supervision program as well that Joyce just put in the chat. So the supervision program is more for the intermediate to maybe the more advanced learner. We still have some more early learners in our supervision program. And this is the monthly program that I was alluding to earlier, that you're paired up with another dietitian with similar skill level, interest, background, even practice where you're at. So you're paired up with another dietitian, and it's me. So the three of us, we meet monthly, and it's just an ongoing, it's like a membership. So, and you can start and stop the program whenever you like.
Nice.
So not held to some kind of agreement to it.
Wow. Well, thank you so much for sharing. All the links are there, and I will be sending out the replay as well. Well, I'll post it on the group. So thank you so much. I really hope that you all got lots of insight. I know I did. Thank you, Shauna, for being here with us and sharing your expertise with us, your knowledge, and everything that's so lovely about the work that you do.
Wow. My absolute pleasure. I'm so thankful, Joyce, for you bringing me here to talk to your group. So thank you so, so much. And yeah, if anybody has any questions, I think Joyce will probably put my contact information in there somewhere. And yeah, we have a couple of links there in the chat. And yeah, thank you so, so much. This was a real pleasure.
Yeah, thank you. Bye, everyone. Thank you for joining us today. I hope you found this as valuable as I did. Bye.
Thank you, everyone. Bye.